Now, first, before we just move into the ulcer, we'll have a look at the gastric anatomy. So, whatever anatomy we will be talking about will actually be divided into two. You have the proximal part of the stomach and you have the distal part of the stomach. Okay, so which means initial part, that is, so the gastric epithelial lining, which means, yeah, this is your stomach. Okay, so first you have the esophagus through the OG junction. These are the gastric rugae, which you can see. This is the body. This identified part is the cardiac of the stomach. This is your fundus. You have your body here. This is your incisura, your antrum, and this is your pyloric sphincter. Fine. So functionally as well as anatomically, it can be divided into an oxyntic gland and you have a pyloric gland, or an oxyntic mucosa and a pyloric mucosa. Okay. So the gastric epithelial lining actually contains multiple rugae. So these are the gastric rugae. Now, these gastric rugae actually contain pits. Okay, these pits are the ones which contain the gastric gland inside. And you have the gastric glands which are specialized for various functions. For example, in the proximal part of the stomach, that is the corpus and the fundus, the glands are divided into 4 to 5. Each gastric pit has got 4 to 5 gastric glands which are made of specialized epithelial cells. And the upper part of the stomach, it contains what you know as the most important thing, that is the parietal cell. This is actually present in the corpus or in the body. Whereas the lower part of the gland, that is your antrum. Your antrum contains different type of cells, which means here you have the parietal cells, which is known for. Here you have the gastrin secreting cells. That is the G cells or the gastrin secreting cells. What is common to both of them is you have the endocrine cells, the somatin cells, somatostatin producing cells, or the B cells. These are present in both. You have the corpus or the body as well as the antrum containing B cells which secrete somatostatin. So somatostatin is basically an inhibitory hormone. Okay, so it inhibits the gastrin secretion. At the same time, it inhibits the parietal secretion. Parietal cell secretion. Parietal cell is what is responsible for your H plus, K plus, ATPase. And this is mainly the enzyme responsible for acid production. So in turn, gastrin is the one which stimulates the parietal cell directly, as well as you have an indirect action as well, which is it also stimulates the ECL or the enterochromaffin cells to secrete H2, that is histamine, which stimulates the parietal cells. So what all are the stimulators for acid secretion? One is you have gastrin, which directly stimulates. Gastrin indirectly stimulates through the enterochromaffin cells, which secrete H2, and H2 causes parietal cell stimulation. Third is you have acetylcholine as such, which is responsible for the secretion of acid because it forms a part of the enteric nervous system. Acetylcholine directly stimulates parietal cells. So gastrin, you have the ECL as well as the H2 from the ECL and acetylcholine. All of them stimulate. And what inhibits? Somatostatin inhibits. So this is important for you all to know because this is the basic gastric physiology. Okay. Now what we need to know is regarding the anatomy, you have different types of gastric glands which are produced. Okay. They are known. See, this is an oxyntic gland. Like anatomically also, you have an oxyntic gland and this is a pyloric gland. Pyloric or the antrum. This is what is, and in the antrum also present. Okay. So now the oxyntic gland is thought, any gland for that matter, it contains the apical pits. Then you have the isthmus or the progenitor zone. Okay. What do you mean by the progenitor zone? Progenitor zone, like any other progenitor zone. Like for example, when you take the cells anywhere else, that is the one which forms the entire lineage. So these basic cells are produced from the progenitor zone and they migrate. For example, the surface mucus cells. The mucus cells produce here and they migrate towards the surface and produce mucus or the mucin secreting cells. Okay. Then you have the mucus neck cells that is present out here. So basically, you have the gastric pit. This is the isthmus or the progenitor zone. This is the neck and this is the base. So the cells in the surface is your surface mucus cell. Mucus cell which migrates down to the neck, that is your neck mucus cell. And you have this cell. How I remember is by CDE. This is what is present in your oxyntic gland. Whereas what is present in your pyloric gland, we already learned gastrin and your this is somatostatin. So C stands for chief cells. Chief cells, what do they produce? Pepsinogen. Very important hormone. It's actually a protein which gets activated into pepsin and it requires an acidic environment. Okay. P is for B cells which secrete the somatostatin. And E, you have the enterochromaffin cells which secrete H2. So this CDE is a part of the oxyntic gland. So there are specialized cells which are present in each gland which has its own function. CDE has its own function. Similarly, you have the G or the gastrin secreting cell which stimulates the parietal cell directly, the ECL indirectly, and secretes acid. Then you have the D cell here as well, which is based on, they are basically endocrine cells, right? So any doubt, you can please stop me. Okay. So this is your gastric pit. So this is your functional anatomy of a gastric pit.